Double up, could you?
All right, we're going online now. Okay, welcome to those that have joined us from home and those here in chambers this evening as we meet for a work session of the Poquoson City Council. We're here tonight to hear the annual report from the York Poquoson Social Services, and we appreciate the input. So, Randy, you want to introduce our guest?
My pleasure, Mr. Mayor, members of council. I am pleased to introduce to you or reintroduce to you Rick Varela. Rick has been our Director of Social Services in a permanent capacity for a little less than a month. Previous to that, he served 5 years as one of the 2 assistant directors of the agency and has over 20 years of service as director in other localities prior to coming to York Poquoson. And since he's fresh and new and it's a hard time to say no to requests, I took advantage of his newness to suggest he come and introduce himself to you and share some of the things that they're doing in social services, and then, of course, answer any questions you might have. Okay. Rick, you'll need to push the button to talk.
Thanks, Rick.
Okay, thank you for this opportunity. We're delighted to come and present our annual report, which covers fiscal year 2018-19. So you have a copy of the annual report and the PowerPoint. So hopefully you had a chance to look through the annual report, which describes our programs and also gives you an idea of the number of people that we serve. So what I'd like to do with the PowerPoint is kind of point some things out to you specific to Poquoson that aren't specified in the annual report. First off, our Child Protective Services and Adult Protective Services reports. What you see is the past 3 calendar years, numbers of reports. And with Child Protective Services, you see in calendar year 18, we had a bit of spike on the number of reports, whereas in Adult Protective Services, we remained fairly stable. And once again, these are the reports that we have in Poquoson. Then the ongoing case, they can be cases where we've done an investigation and further services are required, or cases that come in that don't rise to the level of an investigation, but the families or the individuals require services. So again, you see the caseload for Child Protective Services has maintained stable with a slight decrease, whereas adult services in the past 3 years have increased but stayed fairly stable from 2017 to 2018. Now you can see details on our Child Protective Services and Adult Protective Services on pages 8 through 10 of the annual report. And that gives you a description of those services and the types of things that we do. For example, in Adult Protective Services, some families, we provide what we call stabilization and support services, require a home visit from time to time, referral to other community resources, and there are a number of adult services where we actually have somebody coming into the home for several hours a week. to provide light chore duty services and other things to help the adults with their daily living tasks. I thought I'd give you an idea of how we're doing with our benefit programs. And what you see here are ongoing cases, not individuals. There may be more than one individual in the case. But our TANF program, which is a line across the bottom, those are the public assistance checks that people receive every month. And you see that caseload is fairly small. There aren't a lot of people that receive TANF services, and with since welfare reform, even less that receive the checks that come in every month. Now, the line in the middle is a SNAP program. SNAP is an acronym for Supplemental Nutrition Assistance Program, also known as food stamps. And you see that hovers around 150 cases, with the trend going down with SNAP, and that's probably the result of the better economic times that we're seeing. And again, this goes over the past 3 calendar years, 2016 to 18. And finally, you see Medicaid, otherwise known as medical assistance, and you can see the upward trend that has occurred as a result of the Medicaid expansion legislation that was adopted by the General Assembly this past year. And on pages 11 through 13, you'll see descriptions of our other assistance programs and some numbers. Those numbers you see are number of recipients as opposed to number of cases. So those numbers will be higher than the ones you see on the graph. Now, the most important thing I want to talk to you about tonight is what we actually do. The numbers are nice and maybe of interest to you, but when you talk to me about what you do in social services, these are some of the things that we actually do to help the residents of Poquoson. Over the past year, because of the increase in caseload as a result of the Medicaid expansion, and because of the increase in the number of online applications as well as telephone applications, and by the same token, walk-ins have decreased, we had to redesign our entire benefits program, how we receive those and how we process those applications. So we reorganized. We have about 25 people comprising our benefits program staff, and we reorganized the method on how we take applications, how we process the applications, whether they're approved or denied, and then the approvals go to ongoing workers that work the case from that point forward. And the redesign has resulted in a more efficient type operation. We have 30 days to approve the SNAP and the Medicaid cases. Usually we do a lot better. We can do 15 to 20 days on those approvals. And SNAP, we have 45 days, and usually we can do that better than 30 days on the SNAP. We received added state funding that required no local match, at least for the first 2 years, to absorb the additional cases that we received as a result of the Medicaid expansion. And that 1,100 is both York and Poquoson cases, but that's what the caseload increased, and we hired 2 additional staff to absorb that caseload. We have a program with Poquoson schools called Assessing Community Connection for Educational Success of Students, otherwise known as ACCESS, and the folks at the schools came up with that title and that acronym. And what we do every first Friday, 2 or 3 of our staff are here in Poquoson, and we usually have meetings at all 4 schools, and we meet with school staff, parents, and students of children identified as having problems in school that may relate to some issues going on in the home. So the parents are invited, we meet, we staff the case, determine what services the parents and the kids could benefit from. This is voluntary. If the parents agree to services, we arrange for a social work, we call them family service specialists, to be assigned to the family, and we come up with a service plan with the goal to improve the child's performance at school and improve the situation at home. And we provide a wide variety of services to families to address a wide variety of needs. Some of those related to low income and poverty, others related to counseling and support services and other community resources. The program has been highly successful, and we've served probably last school year, we probably served about a dozen Poquoson families on an ongoing basis. And I have to say, your school staff is great to work with. Tremendously talented, very organized, and it is a pleasure to work with them. And I've been down here a number of Fridays myself, so I've seen firsthand how that program is going. And it is very successful, so successful that one of these school years we may have to increase it to 2 days a week. Third, the fourth bullet rather, we have a adult services multidisciplinary team that addresses a multitude of adult services, adult protective services cases, and we're seeing an increase in homes where hoarding is a problem. So we had a separate task force, and we combined them into one task force. Poquoson Police Department attends regularly at those meetings and contributes significantly, and sometimes they're the only law enforcement people in the room. So we're really happy with their involvement, and they really add a lot of value to those teams. And we've been able to help a number of families. We have some donated funds for the specific purpose of helping families where hoarding is a problem. So we've been able to get into the homes, pay service providers to clean out the home, and we've had pretty good success keeping the homes from becoming cluttered again. The Virginia Initiative for Education and Work works with those TANF families that are receiving checks, and what the goal is to help the head of the household get out into the workforce. By code, they can only receive a check for 24 months, so there's not that much time for us to get people out and self-sufficient. And the VIEW program provides a variety of activities. We provide job finding assistance. We provide workforce training, supportive services, how to write a resume, workshops on how to dress for a job interview, what to say, what not to say, anything that will help these folks get ready to go out into the workforce. And you can see by our low caseload that we've had pretty good success with that program. We provide a variety of crisis and emergency assistance services if someone has a cutoff or if someone has an eviction notice, perhaps needs medication maybe until a Medicaid application is approved or until, happens to run maybe short a month. We help in all of those services. We have donated funds as well as state and federal funds to help with those services that we provide. And oftentimes, if you help with that type of crisis assistance, it helps divert or prevent more serious problems later on. For example, removal of children. You know, a lot of times we've been able to help families so that it doesn't get to the point that the kids have to be removed from the home and the families broken up. We have volunteer teams. We have a half-time volunteer coordinator, and we provide a variety. She coordinates volunteers and provide a variety of volunteer programs. We've done a number of projects here in Poquoson, things such as building ramps on houses and providing food assistance, other types of home repairs. So we have an active crew of volunteers, and we're very happy with the way that program is going. And finally, our staff participates in the monthly food distribution. Our month happens to be November, so we'll have 8 volunteers from our staff come down and distribute food in late November for that. So lastly, the last thing I'd like to point out is on page 17 of the annual report, and that's just to give you an idea of our operation. We employ 65 when we're at full staff. About 25 are involved with the benefit programs. About 25 are involved with the child and family programs, and then the rest of the staff provide administrative support. So you can see this is our entire operation, which is almost a $43 million operation, and you can see the vast bulk of that is in Medicaid with medical assistance. Hard to believe that, you know, we serve with the populations of York and Poquoson, 83,000 people, and that population utilized Medicaid $33.5 million. You probably know that most of that money stays into the community, to medical providers, a lot of that to nursing homes and things of that nature. So it's a bit of an economic factor that most of this money stays in the community. You see the supplemental nutrition assistance program, food stamps, $3.4 million. Again, most of that money stays in our community with the local supermarkets and other places that sell groceries. The temporary assistance for needy families, otherwise known as TANF, we mailed just over $345,000 of checks to recipients in Poquoson, and once again, most of that money is spent in the community. The top line is our staff and operation costs. To operate the Department of Social Services is about $3.4 million, and of that, about $2.1 million is York and Poquoson local dollars. By law, Poquoson's share is calculated by a combination of Poquoson's proportion of the caseload and Poquoson's proportion of the population. And that's calculated every month. So, you know, on a monthly basis, it usually falls somewhere around 14% of our total operation is Poquoson's contribution. And then the graph above shows that this entire operation, 95% is state and federal funding, and 5% of that is local match, and Poquoson's share is about 0.7%. So we believe we have a pretty efficient operation for the services we provide. I'm very proud of our staff. They're a bunch of hardworking people. In fact, about this time of year, we start getting after people to take vacations so they don't lose it. That's how hard they work. They work so hard they don't take the leave that they should be taking. So I'm very proud of them. I think we do a good job. All the state reports and everything show our compliance rating among the best of the agencies in the state. So if you don't mind, I'll brag a little bit. on our agency, and it is just a pleasure to go to work at Social Services. So anytime you're up in the Grafton area, we share the building with the York County Sheriff's Department and Fire and Life Safety, so I think all of you know where that is. Anytime you want to drop by, and we'll give you the Cook store and show you what our operation looks like, we'd be happy to have you. So with that, I'll be happy to answer any questions you might have.
Council? Questions?
Rick, how are the hoarding cases referred to you?
The which cases?
The hoarding?
The hoarding cases?
Yeah.
Usually, well, almost all of them come from the community. A lot of them come from neighbors, and a lot of them come from emergency personnel. They'll get a call to the home. They'll go into the home. They'll see it's really bad, and we'll get the referral of them. So emergency personnel and neighbors, I would say, provide the bulk of referrals in that. Sometimes we'll get family. Maybe they'll have adult children that live other places but know what the situation is, and they'll make the referral to us.
Any other questions?
Mr. Mayor?
Yes.
Rick, you may give them a little rundown on the change that's being proposed now for the way the management decisions are made. You're moving more into a management form of decision-making. I just happened to look at some of the paperwork recently that was coming through with York County. It may help
the reconstitution of our board,
yes.
That's what you're referring to?
Yes.
Yes. By law, Department of Social Services localities may choose one of two types of administration. They may choose a citizen administrative board who legally is responsible for all the social services operations, accepting public funds, accepting grants, and determining, how we operate. Everything from how many staff should be dedicated to foster care as opposed to child protective services, to determining how to conduct our volunteer program. Do we need additional staff? Do we apply additional funding when it becomes available? All those decisions can be done by a citizen-appointed board. The other option is that the board is constituted by one or more local officials and that there be a citizen advisory board. So we have just changed from a citizen administrative board to a citizen advisory board with 2 representatives from Poquoson on that advisory board. And now the administrative board is the county administrator for York and Randy, the city manager for Poquoson. So that is to say that my boss has changed. My boss before the change was 7 citizens, and now my bosses are Randy and Neil Morgan. The way we're structured now, I am a direct report of a deputy county administrator in York who provides my day-to-day supervision. And then Randy and Neil make the major programmatic decisions. A lot of those decisions have to do with classification and compensation of staff, as well as major program decisions. So I think it's a much more efficient structure. When we had the administrative citizen board, they met once a month, and that oftentimes would delay decisions. Right now, things I think can happen quicker. If I need Randy or Neil Morgan, they're just a phone call away. And they are in together a lot at various meetings and things like that. So, they remain abreast of social services developments and additions. So did I answer the question?
Yes, you did.
For you, and that's it. And, bottom line is, I think this will be a better and more efficient way of making major decisions. And I think having a citizen advisory board will allow those folks to get into more of what they're interested in, and that's the programmatic. They want to know about child protective services. They want to know about community activities. They want to know about the hoarding teams and how they're working. So they'll be able to get into that a little bit more. So I think it's kind of a win-win situation.
Anything else? Rick, thank you for your time this
Thank
evening.
you.
What I would tell you is we always appreciate, and sometimes, and every year we need to hear, of the cases that affect Poquoson. It's easy for us to sometimes forget that we are a city like all other cities, and we have issues that involve social services. A lot of times we underestimate the level, and bringing this message home to us makes us understand how important it is to support you and support York County, as well as to represent you with the state and federal governments when your dollars are being challenged. So thank you for your report, and thank you for your service, and really appreciate what y'all do.
And
So
you're
thank
welcome,
you.
and I thank council for your support as
Okay.
well.
All right, thank you. I don't think we have anything else, so we'll close out the work session.